Jet Set!
Thanks for tuning in to the Jetset Physical Therapy Podcast. Our guest, Michael Shacklock, he's one of my physical therapy heroes. His book, Clinical Neurodynamics, was probably one of the first books I bought in physical therapy school, when I had no money. And I read that thing cover to cover. And just to think that I get to work alongside of him in Tokyo and Scottsdale and Portland, Seattle, Stanford University. It's been just a great experience for Jetset and myself personally. You should give him a follow on social media. Neurodynamic Solutions, at Neurodynamic Solutions. I vouch for all the stuff that he puts on his profile. It's well thought out and it's fairly accurate with the current literature. And while you're at it, give us a follow as well at Jetset Rehab Ed. That's at Jetset Rehab Ed. And check out some of the Con Ed classes that we have coming out. And let's drop into our conversation with the great Michael Shacklock in Tokyo, Japan. I hope you enjoy it. All right, back in Tokyo with Michael Shacklock. Yeah. Is there any plans for you to put on videos on YouTube that are a little bit more accurate? That's a tough one, right?
Not in the immediate future. We have to be really careful because if we put our content on social media, people use it and they think that seeing something is knowing it and having the skills to do it properly.
Right.
And we've found that a lot of people are even coming on our courses and secretly recording things against our regulations, and they're still using this material for commercial purposes incorrectly. And so it's been a trial for me, really, to decide what we release and what we don't. And we've pretty much decided not to release very much. We feel that people who come on our courses they've invested in it and they deserve our undivided attention and support. We don't think it's right that people who use other people's material badly should be validated and supported.
Right. Sure.
Yeah. And so and so we give our best to the people who come on our course as much as we can. They have our undivided attention. So the immediate plans are not really to release much on YouTube. Feeling it, are you? Okay, then just come up here. Do that. And your movement, stay there. Your movement should be like this. Okay? Okay?
Yeah, that's one of the reasons we like your course is because it requires in-person and hands-on. And it kind of forces people to go out and travel and actually get in-person content. Yeah. I was curious to know what you think the future of education is going to be.
That's a really big question.
Yeah, that's a good question for you too, Jay.
Yeah.
As an educator. Yeah.
Well, you feel free to go first if you like.
No, I mean, I think it's gone so heavily towards online courses. But the funny thing is our profession is so heavily reliant upon face-to-face encounters and, putting our hands on patients and feeling things. And that's stuff that you're not going to be able to pick up in an online class. I mean, you're going to be able to pick up theory, sure, but to actually be able to practice the elements, like even if we talk about some of the techniques you showed us yesterday, headaches, managing cervical headaches, managing thoracic outlet, it's like there's very precise handholds and things that have to happen in order to limit some of the irritation to the nerve and the system itself. And so we do still need manual or face-to-face classes. I would say that this has been one of our first classes that we've actually done, which has been a hybrid. And I do like that aspect of things where people do some of the theory and then they come in and it's like, okay, here's some questions I have from the theory, but let's build on that now and let's really take the time to really understand our manual skills. Because again, that's what's going to get patients better, putting your hands on them. You can't just talk your way through a patient exam. You've got to be able to do something to really make them better.
Yeah. And to clarify hybrid, you mean half online,
or a portion of the class is online.
Yes,
Yes, that's
correct.
right. Yeah.
Yeah, what do you think?
Yeah, I think it's great. I think online you have great opportunity to review things many times, and if you see a one-off presentation in person, that you can learn the richness of experience with that. But sometimes the method and so forth are not reinforced quite so much because there's not too much time, and you can review that online.
Yeah.
And we have all our manual physical techniques online as well, and so people can return to them, look at the video, practice after, and reinforce what we've learned in person. But the future of education, I think, is going to be. I think there's going to be more and more information, and it's going to be less and less valuable. Mm-hmm. Because at the moment we're suffering from more is less. Mm-hmm. Every time you see something, you've probably seen it 20 or 30 times said or done by someone else. Mm-hmm. And so we're being our time is being consumed, and I would say wasted, mm-hmm. by watching the same thing over and over again. Mm-hmm. But it's special because some particular person presented it, mm-hmm. but it's still only a copy.
Right.
And so my feeling is if you know your stuff, mm-hmm. you don't actually need much of social media. Mm-hmm. I watch a little bit of social media to learn something from someone who I've not seen or material I've not been aware of. Mm-hmm. Fantastic, but I don't come away thinking I know that.
Right.
It's a stimulus for me to look into it and learn it properly.
Yeah. Yeah, you should be raising more questions, right? Rather than just saying, that's the answer and I know enough about it now. Yeah, I agree.
And information is going to be less and less valuable because it'll be more repeatedly mm-hmm. and widely distributed. Mm-hmm. And so I think our core values and skills remain important because if you think of even in the pain science and psychosocial, when you touch someone, when you palpate someone, if you move someone passively, mm-hmm. that's not a cure. And you often can't even make a diagnosis with it, but it's a start. And then if you can then make a physical diagnosis with your hands, show someone how to move well with your hands and be more active with some precision, and then you can teach them as a home exercise and home management. And to me, the holy grail is freedom and independence in the patient, mm-hmm. And cures are rare, so we can teach the patient, even from our hands to the patient, how to manage these things themselves. And so I still feel that the in-person part is a core strategy value mm-hmm. that at the moment we should not give up.
Right.
And we need more skills in that area.
Yeah, I agree.
Yeah, and you'll see when you look at these clips like how important that is, especially with your course.
Yeah, the hard part is stopping. You've got to stop the wrist flexion, so you stop that there with that. Yeah, that's it. Yeah, for me it's difficult as well because it's more flat and it's not like a chord so much, and so yeah, that's it. So now I'm going to add to that.
Yeah, that's it.
Can you feel it now?
Oh yeah.
And then the other thing I was kind of telling you, we were on the subway, the Tokyo Underground, on the way to class, and I was just watching all the students like kind of. A lot of them, that was their first time, traveling in Japan, in Tokyo. Okay. And I said, I think that's maybe a part of the education too, just the experience.
Yeah, absolutely. It's a broad experience. Traveling, you've got a few days either side, and with a hybrid, the in-person part's condensed, so you've got more time around to enjoy the local environment, the people, the culture, and so forth.
Yeah. So we're here in Tokyo now. You've taught a course for us at Fort Bliss in El Paso with the U.S. Army. Mm-hmm. We've worked with you in Portland, Oregon, Seattle, Washington,
Vegas,
Stanford.
That's Stanford University.
Stanford University and Las Vegas. Yep. So, any preference on your part? All these places that we've traveled together.
They're all good. Well, I mean, we're talking about going to Cancun, aren't we? Is it Cabo?
Cabo, yeah.
Cabo, sorry. Yeah. Cabo.
I mean, we'll see. Yeah, that'd be great if we could. Get you in so many different countries.
Yeah, you bet. Yeah. You bet.
Yeah. But which one's your favorite? What's your favorite city out of all those? No offense to all whoever loses. Yeah.
Gee, that's a good one. I wish I could tell. I'm not very good at making these decisions.
Putting you on the spot
If you want fun and extravagance, extremes, you'd go to Vegas.
Yeah.
Wouldn't you?
Yeah.
You go to Vegas. If you want something quiet, which is a little more conservative, a lower cost of living, you go to El Paso. Mm-hmm. You've got a bit of Hispanic influence there, well, a lot really, and I like that.
Fantastic food.
Yeah.
Fantastic food over there.
Yeah.
Well, what's been your favorite meal here in Japan?
I think last night.
Together. Last night. Yeah.
Yeah, we did sashimi and tempura.
Sashimi, tempura, and unagi.
Yeah.
We had a great dinner.
It was really
Yeah.
nice. Japan does food well. Whoa, really well.
Yeah.
Oh yeah, the clips of our students just showing like, everyone's taking pictures of their food.
Yeah.
I think the Japanese people people will say they have a stereotype of taking pictures of everything.
Yeah.
I will say that the people in our class are taking more pictures than anybody I've ever seen of everything they're eating.
Yeah. Yeah.
And the food looks great.
Yeah.
With their,
Really good.
I will say, you were talking earlier about like the travel, like that's part of the thing.
Yeah, the experience.
What's been cool about the last couple of classes we've had in Japan is we've had some Japanese students. And they've interacted with obviously the PTs who've come across from the States, and there's something there as well. Like I know when I was talking to my one of my friends who's taken the course, Ken, he's like really like excited to work with the American PTs and learn a little bit from and how they process and think. And he said it was something that stood out to him. And then there's some of the American PTs who are like, oh, these Japanese students are just so on point. They're so dialed in. They're so focused. Yeah. And then, there's things you pick up from being exposed to another culture and another group of students as well.
Absolutely.
I just think it's just building a network like that is super valuable. Because, it's kind of funny that physical therapy is a global profession. It's so different.
Yeah.
Everywhere you go.
Yeah, it is.
Yeah, it is. So it's one of the world's most important health issues, like lack of activity and lack of moving well. That's our job.
Yeah.
That's our job.
Yep.
Yeah. Any places on your bucket list for traveling?
Bucket list. Look, I've been to a whole lot of places.
You've been all over the world.
Most major cities.
This is a true jet setter right here.
Yeah, I know.
Ladies and gentlemen. Yeah.
Gee whiz. Not much is left unturned at the moment. I'm mostly returning to venues that I've been to before. Maybe some East European places. I go to Poland now, and we're getting through Slovakia and Czech Republic now. I go to the Prague, see the Prague people there with their movement history. What's next? What would I like? Not sure. I'm sorry I'm not being very decisive here, but
all right. Well,
I'm calming
put
down
Kavo on
these
your
days.
list for you.
Yeah, you can organise it. Yeah, please.
I did want to say, and then we'll just get back a little bit to the clinical aspect of things. You talk a little bit about, you talked in this course about, if it's MSK versus, more nerve, right? And taking the correct trainer, to kind of treat. What are your thoughts on integration of, NDS concepts into, because you brought up the Prague School. You brought up a little bit about them and they're, obviously they have the DNS process. And I know you're familiar with Shirley Sarman's work with MSI and even, some of the other works out there. What's your thoughts on integration and utilization of that with some of your work?
I actually feel that's the future. And think of clinical neurodynamics, that there's a subgroup of patient problems, the 3C group, which is multistructural, where if we see someone with a lot of pain at the beginning, we can't do a ton of things with them, but our objective is to give them pain relief with unloading. And then as they improve, they can start some rehab. And then when they're finalising, they're all optimising their movement. I think we have to integrate neurodynamics with other movement strategies. DNS, Simon, Stu McGill's approach. I feel that if we get our heads in the right space, focus on the right things, we can integrate them, and we should. And that's what I say in the courses where, in our situation anyway, the most common cause of neurodynamic problems is pressure. It's usually a radiculopathy with disc hernia and or other things, of course. And even in peripheral neuropathy, pressure is a common problem. And I'm talking about it in the MSK context. I'm not talking about genetic neuropathies or diabetes and all these other things, whilst they can integrate sometimes. I feel that we can teach people how to move off their nerve instead of on their nerve.
Right.
And that's kind of neurodynamically, that's a protective strategy, but musculoskeletally, it's an appropriate movement strategy. And so finally, if we are balancing both systems, interacting really well, that's healthy strategy for pain and movement.
Yeah.
And as I said on the course, neurodynamically, we are dealing with one thing, movement-related nerve pain. And if it involves movement, you got to move well.
Right.
And so for me, the future should be how to integrate MSK and nerve, and that's what we call the 3C technique in high performance sometimes. And if you think of MSK and nerve, that we have often treated them separately, or the logic was treat MSK and that should help the nerve. True, sometimes.
Right.
Or if it doesn't, we mobilise the nerve separately.
Right.
That's still artificial, or it's incomplete. And so when we integrate them, we can do multi-structural, multi-movement, or multi-dimensional treatments. And I say, because that relationship between the two systems is special, 2 + 2 = 5. Because we're actually dealing with the interactions. We're not just dealing with each system.
Interesting. Yeah, I mean,
that was my takeaway. Like, just as someone who's taking your course 4 or 5 times now, that just like seeing it as 2 different systems. Like thoracic outlet was like the big example that really hit home for me, which is like, you think of thoracic outlet as tight pecs. You got to stretch the pecs, but you can't do that if the nerve is irritated, right? Because you will compress the nerve. So it's 2 different systems, and sometimes you have to get one better before you get to the other one.
Yes.
Right, but you do have to get to both of them.
Yes, exactly, and that's where we talk about model A and model B. We think of the nervous system MSK interactions as being a model, but actually that's not true. It's 2 models, and the first model is what's good for MSK is also good for nerve. So if we fix MSK, it should help the nerve. Absolutely true for certain but locations based on anatomy and biomechanics. Like the medial ankle for tibial nerves, that's correct. Right. If you depronate, you do take the load off the nerves, so you're helping both. That's a cooperative, model A. But unfortunately, other parts of the body are model B, where they are competitive, meaning if you stretch pectoralis minor for thoracic outlet, that's good for pec minor, good for MSK, but it presses on the plexus. And so if you've got a hypersensitive plexus, we would, for a short time, unload the plexus, omit treatment to MSK while that person's pain reduces, and then when they're capable, we then return to MSK.
To help.
Right.
So we're using different strategies along the path of a patient problem to resolve the competition between the two, or conflicts. When one settles, you then go to the other. And that's integration.
Yeah, and for those of you out there that are, kind of struggling with that, you're stretching the pecs, their arms going numb. Learning the system of Michael Shacklock's Neurodynamic Solutions is going to help you out a lot with that. Because I know that's for me as a clinician, that was always like, which one am I going to do, right?
I would love to see integrative course at some point. I think that would be something special. Maybe you and Claire could get together and put your heads together and build a framework around that. That'd be really cool. I think it'd
be like getting the Beatles back together.
Yeah.
I'll take anything I can get.
Yeah. All right.
So we're I have one more question and then we'll end the show. For somebody that's struggling with integrating this into them, of course taking your course is the best, but what are some common tips that you would have for someone to let's say they can't make it out to one of your courses, with some reading material or something you could lead them to?
I have a book called Clinical Neurodynamics.
Very good book.
In the future I'll be writing more, which will be updates and more sophisticated and more targeted material. But we have online courses as well. We have the upper and lower quarter level 1. We're actually now separating them to upper quarter 1 and 2 and lower quarter 1 and 2. And you can buy those courses online, and you can then track into an in-person part of a hybrid course or another in-person course somewhere else. So you don't have to buy the whole thing. You can start at one point, and it's a hub where you could branch out into any of the other courses, in a cost-effective way and time-effective way. And you can also go to Jetset. They're selling our hybrids and stuff like that. And so, contact these guys.
And so we are in Tokyo with the great Michael Shacklock. You can follow him on social at Neurodynamic Solutions. Don't follow at Neurodynamics.
No, we lost the account.
Yeah,
we
we
had
lost
about
that
14 or 15,000 followers, and it got hacked.
Oh, no.
And we've not been able to get it back.
Yeah, so Neurodynamic Solutions.
Neurodynamic
Right, that's
Solutions.
right.
Yeah.
And then, give us a follow at Jetset Rehab ED if you want to see what kind of courses we have coming up with Michael, with other people, which in different places. And man, this has been just a fantastic trip in Tokyo with you. It's one of my favorite courses that I've taken and organized.
Yeah, and if there is one more thing, because we're on YouTube now. Hit that like button if you guys, and the subscribe button if you guys want to see more content from us.
This is one of the only good neurodynamics videos on YouTube, right?
Right. The only one.
The only one. Yeah. All right. But thank you very much. And man, follow this guy. He has some great material up for you to just clarifies everything.
Yep. Thank you, Michael.
All right.
Thank you.
Any last words?
Thanks for coming, guys. It's been a great pleasure. Thanks for letting me work
had a lot of fun
guys.
with you. Yeah.
And we'll be doing this again.
Yep.
All
Awesome.
right.
A place where we can
Jetset. Jetset.